And for COVID, testing is surging here in California and all across the country, and that's because of the Delta variant and also the increase in the need for people to show proof of negative tests in order to go places and do things.
Yeah, COVID testing should be free, but there are exceptions. KCRA 3 investigates Brittany Johnson set out to get the facts. She joins us live from the newsroom. So, Brittany, what did you find?
Well, Lisa and Brian, many people are getting a surprise bill after being tested for COVID-19. So over the last month, our digital team reached out to several California state and local agencies, major health insurance companies, and covered California to get the facts. So here's what you should know, starting with COVID testing for free tonight. You don't need to have COVID-19 symptoms or a known exposure to get tested for free. Federal guidance states health plans must cover COVID-19 diagnostic testing for their enrollees by any provider without cost sharing. Now, there is no distinction on whether someone is an essential worker and no limit on the number of times someone gets tested. Moving on to health plans. Health plans should give individuals the benefit of the doubt and cover the test, even for travel. From the federal guidance, they say, quote, when an individual seeks and receives a COVID-19 diagnostic test from a licensed or authorized healthcare provider, or when a licensed or authorized healthcare provider refers an individual for a COVID-19 diagnostic test, plans and issuers generally must assume that the receipt of the test reflects an individualized clinical assessment and that the test should be covered without cost sharing, prior authorization, or other medical management requirements. A spokesperson for California's Department of Managed Healthcare told KCRA 3, as long as the test was done as an individualized clinical assessment, it should be covered even if it was done for travel or admittance to an entertainment venue. Finally, to avoid all of this possible entanglement with your health insurer over fees, just get tested at a community-based testing site. Sacramento County has 13 of those sites. Now, if you were charged for a COVID-19 test and you do think you should be reimbursed, go to our website, kcra.com, and click on this story or just scan that QR code right there. There we do outline the steps for you to take. We also want you to email us at kcrainvestigates@kcra.com.